Hello, everyone. The webinar will be beginning in just a few moments. Thank you for joining us today. Hello, everyone, and welcome to today's Research Roundtable focusing on the theme of autism and epilepsy. We have an excellent lineup of speakers today. Firstly, we'll be hearing from Susana, who is autistic and has epilepsy, about her experiences of living with the conditions. We will then hear from Dr. Charlotte Tai at King's College London, who in 2020 was awarded the Epilepsy Research UK and Autistica Fellowship Award, and will be speaking about her fellowship research. And finally, we will hear from Dr. Colin Riley, who has been commissioned by Autistica, Epilepsy Research UK and Young Epilepsy to produce the Autism and Epilepsy dossier, which has been published today. So first and foremost, I would like to hand over to our first speaker, Susana. So welcome, Susana, over to you.
Hello, I'm Susana Pantoni. I'm 26 years old and I was diagnosed with focal epilepsy when I was 3. And then 12 years later, I was eventually diagnosed with autism when I was 50. Now, recently I have come to realize that for a female who is highly cognitively able, 15 is a pretty young age to get a diagnosis. But for me, it was late. It's hard enough growing up with uncontrolled epilepsy, but doing so in a world that is completely unsuitable for neurodiverse people just makes it even harder. And for the first 15 years of my life, I had to navigate it without any built understanding of myself and pretty much no support whatsoever. So when my diagnosis came, it was a blessing, but it took time for me to adapt. For about a year or so after my autism diagnosis, I was in denial. Not because it didn't make sense or fit, it totally did, but because receiving that diagnosis put me in a situation that I simply could not accept to be true. The day after my diagnosis, I went into school, bumped into the pastoral manager and told her, and her immediate reaction was, "Oh yes, we've always known." And that one sentence just filled me with an intense sense of fury. I felt like I'd been let down by the entire system. How had something that was now so blatantly obvious been overlooked by so many people for so long? How had my teachers allowed me to be constantly punished for things that clearly weren't in my control, yet those who chose to verbally and physically abuse me rarely even got as much as a warning? Of course, epilepsy didn't really help this process of acceptance, and I do believe that already having that diagnosis may have played a part in the delay of my second one. People already had something to blame my issues on, i.e. she's irritable and aggressive because of her meds, or she doesn't sleep well because of seizures. So going from having this one condition that had pretty much defined me my entire life to suddenly having to accept a second one was just really difficult, I guess, almost in a stereotypical autistic way. I remember shortly after my diagnosis, a clinician told me that I needed to start viewing autism as my main condition rather than epilepsy. And at the time, that just wasn't possible for me. I hadn't fully processed it yet. I didn't really understand what it meant. I just could not do that. But several years later, I realized what she had said was completely false, because I don't have a main condition. And that's what I'm really passionate about making the wider world see. Both affect me equally. Co-occurring conditions are exactly that. Issues that go hand in hand together. And I strongly believe that this mindset needs to be adopted by all in order for understanding and care to improve. Because it doesn't matter that my diagnoses came at different times in my life. The blunt reality is I've had both conditions since the day I was born, and they need to be treated equally as one. And this is backed up when you look at just how effective my vagal nerve stimulator has been. I had a VNS implant back in 2019, and it has completely changed my life. Research shows that these devices not only improve mental health, but can also reduce autistic behaviors on top of improving seizure control. And for me, that definitely feels like it's the case. It's coming up to about 12 weeks now since I had my last major seizure, which is something I don't think I've ever been able to say before. And I honestly cannot remember the last time that I had a full-blown meltdown, got myself into a state of frustration and overwhelm that I wasn't able to pull myself out of. Now, life has never been easy for me, and it never will be. I started school just 4 weeks after my 4th birthday, and from the moment I walked through those doors, I was labelled negatively as being bad and naughty because I didn't yet have that autism diagnosis, and I behaved in a way that wasn't seen as correct. And it's really only in the last year that I've been able to start shaking those negative views of myself. But now, 10 years on from receiving my diagnosis, I have a better understanding of myself. And despite all my struggles, I'm looking forward to moving on in my life and hopefully kickstarting my own career in autism research. Personally, I feel like research is headed in the right direction now, and I'm really excited to become part of that. In recent years, I've seen an absolute flurry of qualitative and participatory projects popping up, which is just really exciting and inspiring to me. I think the next step is just to start approaching topics from a broader angle, start researching people and their experiences as a whole, rather than as a list of symptoms attached to different conditions. And once this happens, understanding will increase and we can begin to improve and adapt the world that we live in. Thank you for listening.
Thank you so much, Susana. I had goosebumps towards the end of your talk because it was just such a positive note that you finished on, that that research is hopefully headed in the right direction. And of course, you mentioned that you had a VNS implanted in 2019, and that you haven't had a seizure in 12 weeks. We at Epilepsy Research UK have funded research in VNS in the past, and I wondered beforehand, you had uncontrolled epilepsy, but how often were your seizures then?
So I graduated, I completed a master's degree in 2018, and I've been on what I call a prolonged hiatus since then, because throughout 2019, my epilepsy just escalated, experienced status at least twice during the year. February was like 30 seizures in 30 hours. Started a new medication that just completely gave me toxicity, could barely even walk. And it just reached the point where I was kind of just willing to accept anything. I knew there was a 2 in 3 chance that VNS would help. And at that moment, a tiny bit of improvement would have been just unbelievable, because I'd spent this whole year literally questioning whether, if I went to bed at night, because most of my seizures are nocturnal, whether I'd wake up again in the morning. And I do have a lot of anxiety around sleep, particularly because of that. But yeah, as I said, it's literally last week I woke up and my sister came in the room, was like, "Oh, what have you done to your lip?" And I was like, "Oh, wow, I bit it in the night. I must have had a seizure." And it's the fact that I'm literally judging now whether I'm having seizures based on if I've hurt my mouth, and not the fact that I've woken up in the middle of the night screaming.
So it has made a huge difference in terms of your epilepsy, really, although I completely living with that anxiety must be a huge burden for you to bear as well.
Yeah, I mean, the improvement it's made on my mental health is unbelievable as well. I'd say I probably suffered from depression to an extent since I was about 7 years old. And just before my birthday last year, something seemed to click in my head, and all of a sudden I was like, these songs I'd been listening to for years I was hearing them differently. And it's like, just out of the blue, I just came out this rut that I'd been stuck in for 10, 15 years. And yeah, the only real explanation is, all right, the VNS is doing that as well.
Wow. Wow. Well, thank you so much, Susana, for joining us and speaking with us today. We'll be bringing you back in after we've heard from Charlotte and Colin, because we've had some questions that we're going to discuss. But thank you so much for now, Susana. That was really, really fascinating. Thank you. And now I would like to introduce Dr. Charlotte Tai, who is from King's College London and is the Epilepsy Research UK and Autistica Fellow. Brilliant. So over to you, Charlotte.
Thank you. Thank you, Quiva, and for inviting me to be part of this webinar. And thank you also to Susana for sharing your experiences. I'm a researcher at King's College London, and I've been interested in the overlap between epilepsy and behaviour with a focus on autism for several years, with a more recent spotlight on very early development. And in this presentation, I'd like to tell you why early development might be important for understanding the overlap between autism and epilepsy, and introduce our new study, the Brain Development in Early Epilepsy study. The link between epilepsy and autism has been documented for several decades, and we now know that up to 40% of people living with epilepsy are autistic. And this is higher than the general population, in which around 1 to 2% are diagnosed with autism. Autistic people that live with epilepsy have a higher likelihood of physical and mental health difficulties, including sleep problems, ADHD, anxiety and depression, a reduced quality of life, and a shortened life expectancy. And so it's really important that we try and understand the reasons for the overlap between autism and epilepsy so that we can try and improve these outcomes. And for this reason, both Autistica and Epilepsy Research UK hosted workshops in the last few years that brought together key stakeholders, so researchers, doctors, and people with lived experience to identify key areas of priority for research. And I was lucky enough to attend and contribute and able to develop my research on this basis. And one area that was highlighted as a priority area was trying to understand a bit more about the potential shared underlying biology between autism and epilepsy. And we know in epilepsy, that's been studied quite separately, that changes in the way that the brain is wired or connectivity is shown in people living with epilepsy. And research conducted separately with autistic people shows that connectivity might be slightly altered as well. So potentially the way that the brain develops and wires could be something that is shared between epilepsy and autism. So in terms of how the brain is wired and develops in the first place, we know that the first few years of life are a period of very rapid and complex development of the brain, which also interacts with the development of behaviour and learning abilities. And quite a large proportion of autistic people living with epilepsy had their first seizure quite early in life. However, the majority of studies investigating the link between autism and epilepsy have asked parents to try and remember what their child was like in those early years after a diagnosis of autism has been established or after behavioural difficulties have manifested. So it's important that we try and understand how the brain is developing from very early in life. And in this way, we might be able to identify if there are any differences in early brain development, focusing in on this change in connectivity and wiring that might predict later behaviour. And this sort of prospective approach, so studying from very early in life, has been used in previous studies by my colleagues at the Birkbeck Baby Lab and in our research working with babies with a rare genetic condition called tuberous sclerosis complex. And these studies are starting to give support for the idea of infant precursors of later behavioural outcomes. So all of this has led to the development of our new B study, Brain Development in Early Epilepsy study. And we'll be inviting 80 or more parents or carers of babies with epilepsy to take part over several time points in the first 2 years of life. The first time point will be at the point of diagnosis of epilepsy, and this will be entirely remote through online surveys, parents collecting videos using structured play assessments, and obtaining clinical records with consent. And at 10, 14, and 24 months, we'll be conducting more in-depth research assessments, looking at standardized measures of behavior and learning, as well as more objective measures of development. So this includes eye tracking, which uses infrared cameras to investigate where a baby is looking on a screen and what they might be more interested in. And this video here is an example of eye tracking conducted in the home. And also EEG, which is a measure of the naturally occurring electrical activity of the brain, so we can start to tap into changes in brain development from early in life. And importantly, all of these assessments can now be conducted in the family home with technological advances. And this reduces burden on families who will have to travel to a hospital for multiple assessments, and also increases familiarity for the babies. Importantly, also, we will be able to use the information that we've gathered from previous studies that I just mentioned to allow direct comparison across different populations of babies. So taken together, this work is trying to identify what aspects of brain development and function might predict behavior, and when this occurs in development as well. And this could help us to understand what kind of support strategies might be needed for children that might be at a higher likelihood of experiencing difficulties. And also, by taking this longitudinal perspective approach, we'll be able to understand what features of early development are important for later social and cognitive development, and what aren't so much. And this might help us to find ways to track the effectiveness of different support strategies as well. And just before I finish, I'd like to quickly mention our integrated involvement project called the Be Parents Priority Project, or BPP, in which we're working closely with parents to co-develop priorities for research in this area, alongside the Epilepsy Research UK SHAPE network and Young Epilepsy. So we're aiming to document the lived experiences of families of children with early onset epilepsy and identify priorities for research from their perspective, focused on early development and behaviour. And we're using a range of different approaches, including an online survey which has been co-designed with parents, a focus group to gain more rich information about experiences, and finishing off with written and video animation outputs, which will be co-developed with parents as well. So we're inviting parents and carers of children up to 11 years old to take part in this study. And if you'd like to find out a bit more about the overall B study or the BPP project, please do get in touch. But for now, thank you very much for listening. Thank you to Epilepsy Research UK and Autistica and your supporters for making this research possible, to our collaborators and to the B study team. Thank you.
Thank you so much, Charlotte. That was brilliant to hear about this exciting work. And what struck me was you mentioned that the eye tracking and the EEG are all taking place in the family home, which, as you said, reduces burden, but also must have advantages in this post-COVID world that we're living in.
Absolutely. So far, we've found that families are much more happy for us to visit them in their home, in their familiar surroundings, than coming to us to our research centre in London. And yeah, being able to use these technologies in the family home means that we're able to reach families across the UK that might not want to travel all the way to London to see us to do these assessments. So it means that we can see more families and hopefully make a more positive impact in the future as well.
Brilliant. Well, thank you so much, Charlotte. And again, we'll be coming back to you at the end of the presentations with some questions. But thank you so much for speaking to us about your research.
Thank you.
And now I would like to introduce Dr. Colin Riley, who has been commissioned by Autistica, Epilepsy Research UK and Young Epilepsy to produce the Autism and Epilepsy dossier, which has been published today. So over to you, Colin.
Thank you very much, Caoimhe. So the project I'm going to talk about today is, as Caoimhe mentioned, a project which really seeks to lay out the evidence for the, co-occurrence between autism and epilepsy. I guess the first question concerns why it is important to examine the relationship between epilepsy and autism. And as both Susana and Charlotte have already mentioned, co-occurring epilepsy can significantly contribute to decreased quality of life, but also increased risk of early death among autistic people. So very important that we understand this relationship a little bit better. The prevalence of epilepsy in autistic people is higher than in non-autistic people. A review in 2019 suggested a prevalence rate of 12% of epilepsy in autistic people, but some studies have shown up to 40 or 50%. And in the general population, the prevalence of autism is around 1%. If we look at the other side of the coin, people with epilepsy also have a higher prevalence of autism than people without epilepsy. And this study in 2017, or this review in 2017, suggested a prevalence rate of 6%. But again, some studies have shown, prevalence rates of 20 to 30%. So having autism is a risk for having epilepsy, and having epilepsy is a risk for having autism. So in terms of gathering the evidence, what did we want to do, or what were our project aims? The project had three main aims, or three main parts. Firstly, we wanted to systematically review research which has focused on the risk factors for the occurrence of epilepsy in autistic individuals. We also wanted to gain insight into the lived experiences of autistic individuals with epilepsy. And finally, we wanted to look at the economic costs of having both conditions. So how did we carry out the study? We used two main approaches, or two main methods. The first being systematic literature reviews. So these are reviews which examine all relevant research studies and summarize the findings to answer a research question. And secondly, we formed a patient and public involvement, or PPI group. So we met with autistic people with epilepsy and also caregivers of autistic people with epilepsy on 3 occasions digitally. And a PPI group really is an expert group which can give novel insights into research, or research questions. So regarding our first aim, focusing on the risk factors for having epilepsy in autistic individuals, we identified 51 relevant papers. Over 450,000 autistic individuals were involved in those 51 studies. And a wide range of factors were considered, but the factor most often associated with the occurrence of epilepsy in autistic individuals was the presence of learning or intellectual disability. So what that basically means is autistic people with learning disability have a greater chance of also having epilepsy compared with autistic people without learning disability. That does not mean that autistic people without learning disability cannot have epilepsy, but there's an increased chance if you have a learning disability. The evidence for other factors, all other factors, was inconclusive. And just to sort of give a figure, this figure sort of illustrates that. So as I said, in 100% of studies, of all studies where we looked at learning disability, we found it was associated, significantly associated with epilepsy in autistic people. But if we look at the other side of this figure, we have developmental regression. So a good number of autistic people report that they have lost skills or they have reached a plateau in skills. So early on in a child's life, for example, they lose skills or they reach a developmental plateau. That was found to be significantly associated with epilepsy in autistic people in only 29% of the studies we looked at, 29% of the studies where it was considered. And one might wonder, why is there this inconsistency? Well, one of the things we looked at was study quality, and many of the studies which we looked at had quite low study quality. So that could be study design, where there's inbuilt biases. It could be, for example, in terms of developmental regression, how that regression is actually defined. So there is more work to be done here, but the clear, the clear factor that is important, or most important, is having a learning disability. Our second aim was really around, what's it like to live with co-occurring epilepsy and autism. We undertook a systematic review again, and our review found no papers. So we had to really rely on our expert group, our PPI group of autistic individuals with epilepsy. We analysed the findings from our meetings, and 18 separate teams emerged, so quite a lot of teams. And I want to focus on two of those teams today in terms of, you know, two of the most prominent teams around this relationship. The first team here is the lack of understanding of autism epilepsy comorbidity. So really a lack of understanding among health professionals that these two conditions often co-occur. One of our autistic adults said, when the evidence is so clear, these conditions go hand in hand, how can those departments not talk to one another? So this, and the individual gave an example of, you know, meeting their adult neurologist and really sensing that the neurologist did not understand at all their autism and how it would impact on their life and their quality of life. The second theme I want to focus on is that assessment and investigations for epilepsy are often really difficult for autistic people. So these assessments and investigations are necessary in order to determine whether an individual has epilepsy, but for autistic people, they're often quite felt as quite intrusive and really uncomfortable. A mum of an autistic child said, getting her, so her daughter, to sit still for an MRI, an EEG, and blood test was not possible, even though these tests are often very crucial in determining whether or not an individual has epilepsy. The last aim was the financial or the economic impact of having epilepsy and autism. Again, we employed systematic review. We identified only 3 papers from the US and Canada. None came from the UK. And the findings were that autistic people with epilepsy have greater healthcare needs and thus higher costs. But there really was a lack of economic evidence for the cost of epilepsy in autistic people. So again, we had to go back to our PPI group, and they were really good in highlighting many of the costs which have not yet been considered in formal studies. Things like that having autism and epilepsy can affect progress in school and thus future career prospects. And Susana has already mentioned it, but if you have both conditions, you often have difficulties accessing employment, even when qualified for the roles. That can be due to stigma or prejudice. In terms of parents and caregivers, they talked about the impact in relation to their careers and their productivity. So having a child with both conditions affect both, productivity, but also career progression for them. Okay, just in terms of future research, our group and both our research group and our PPI group really feel that more qualitative research is needed with autistic individuals who have epilepsy and also their families. And it's so important to include autistic people with learning difficulties. They're often excluded from such studies, but given that they're probably the highest risk group, it's really important they're included. In terms of health economics, more research is needed on the long-term non-healthcare costs. So what we're talking about there is the impact that living with epilepsy and autism has in terms of job employment prospects, but also the impact on caregivers and even siblings. What steps can be taken, or what steps do we feel should be taken to improve the situation for individuals with both conditions? One thing that's really important is to actually improve the awareness of the frequent co-occurrence in both national guidelines and support organizations. So for example, if someone rings up a helpline for individuals with epilepsy and they talk about their autism, it's really important that the support organization for epilepsy can direct them to a helpline for autistic people. In terms of making hospital visits for epilepsy investigations and consultations more autism friendly, again, it's around improving awareness of autism among epilepsy professionals. So understanding what autism is, how it can present, and how these hospital visits can actually be quite difficult for autistic people. It's really important also to screen individuals with epilepsy for autism, but also for other neurodevelopmental and mental health conditions. Many of these individuals who have epilepsy and autism go for a long time without a diagnosis, so they don't get the support they need, they don't get the understanding they need. And the final thing is to ensure that autistic people with epilepsy have access to evidence-based therapies for other co-occurring conditions. Many of these individuals will have mental health conditions like depression or anxiety, and there is good evidence for the treatment of these conditions, but oftentimes autistic people just don't access those, or they're excluded from access to those particular treatments, and thus having a detrimental impact on quality of life. I just want to finish off by thanking, we're especially grateful to the PPI group members, so autistic people and caregivers of autistic people. I also want to mention my colleagues at UCL and our charity partners who funded the project, Autistica, Young Epilepsy and Epilepsy Research UK. Thank you very much.
Thank you so much, Colin. It's brilliant to see what's come of this work. And I was so shocked when you said, when you were investigating what it's like to have autism and epilepsy, that there are no papers looking at this. Why do you think that is?
I think this idea of co-occurrence in some ways is so old, but also so new, that research often focuses on a condition and neglects, as Suzanne talked about earlier, at looking at the fact that people are people, and they don't respect the boundaries of these conditions, and oftentimes people will have more than one, 2, 3 different conditions, and therefore it's very important to treat them as important subgroups and allow them to talk about their experiences.
Of course, and the way in which the conditions overlap and how they affect each other as well. And you also, at the beginning of your presentation, mentioned all of the different statistics we have for co-occurring autism and epilepsy. Why do you think there's such variation in the statistics that are out there?
I think a lot of it is to do with study design. So how we define autism, how we define epilepsy. Some studies will actually meet the individuals and do, assessment of epilepsy or autism. Other studies will use register-based studies. Some of the studies will be based in hospitals or clinical settings, and some of them will be based, more epidemiological or more population-based studies. So the data does, vary, quite considerably. And I think it's important, to really try to do representative studies where we, try to sort of, identify all individuals who have these particular conditions.
Of course. Well, thank you so much, Colin, for speaking about this research. I would now like to invite Susana and Charlotte to come back whilst we answer some of the questions that we've had submitted. Brilliant. So thank you everyone for joining again and for taking the time to speak today. And the first question, Susana, I'm going to ask you, what one thing would be life-changing for you in terms of your epilepsy? This is a question that we ask members of our SHAPE Epilepsy Research Network.
Yeah, so I think it draws strongly on what Colin was saying. For me, employment is the biggest issue. If you look at the statistics, only 34% of people with epilepsy are in employment. And this is even more shocking when you compare that to the stats for personal independence payment, or PIP, as well. I worked out last year that between April 2014 and November of 2019, 65.5% of people with epilepsy over the age of 16 were without any form of income at some point during that time. And during that, I was one of those. I was originally on DLA, obviously that switched to PIP, and I was denied it. For 19 months, I had to fight to get the income that I was, that I deserved, that was my right to have. And it's the fact, epilepsy is so complex, and even though it's one of the most common conditions out there, it's just still surrounded by so much misunderstanding and taboo. And it just doesn't make sense to me. So for me, it's really about that. It's about improving understanding and just helping people with epilepsy integrate and fulfill their potential. You know, as I said, I have a master's degree and I can't even get an entry-level job because I'm disabled. And I think, you know, following on that as well, my mom has not worked since I was born. She's essentially been my full-time carer my whole life. And I mean, all she gets is £67 a week. So as a family, we're fully reliant on my dad to bring everything in. And, you know, that touches on these economic issues that you have when you have co-occurring conditions, you know, particularly epilepsy, which is just so frowned upon. And I originally come from a media background, and I think that media representation is extremely important in spreading this awareness. And obviously, EastEnders do have a brilliant example of someone with epilepsy, but you know, I've never seen a female autistic person on TV. And so I think those are little things that with better research and better access to research as well, we can start to implement and just start to get that knowledge out there. You know, I have so much anxiety around work, I don't even bother applying because, you know, all my life I was rejected and turned down for things. And I have such a fear of that the idea of even someone saying yes to me doesn't seem possible. And I can't deal with that rejection anymore. So yeah, I'm at that point where I've almost given up really, because the world just doesn't seem to want me to integrate in it.
Thank you so much for sharing, Susana. And I think, yeah, you mentioned about future research is needed to really change things. And I think Colin's work has shown what the steps are for future research so that things can change in this area as well. Thank you so much again, Susana. And so I'd like to turn to our researchers, Colin and Charlotte. How long do you think it will be before the research that you've spoken about today benefits autistic people living with epilepsy? Charlotte, if you'd like to begin.
Yeah, absolutely. So with this sort of longitudinal research where we're studying individuals over quite a long period, as you can imagine, the time frame is a bit slower. But we've built into the project to be able to co-develop guidance and reports before the end of the study. So these will be developed alongside medical doctors, scientists, and people with lived experience of autism and epilepsy, and will provide both health professionals and families with guidance on early development and behaviour associated with early onset epilepsy. So in the shorter term, this is our aim, and looking a bit more forward into the longer term, it would be to use our results to try to inform support strategies for these families, so having a bit more of a direct impact in that way.
Brilliant. Thank you so much, Charlotte. And Colin, how about you?
I think some implications of the study we have done, you know, are very in the very near future. One of the things which is really important is collaboration between support organizations, and this project has shown how that can happen between organizations that support individuals with epilepsy and organizations that support autistic people. So that can really start and has already started, and I think that's really important in increasing that awareness which I've spoken about. The second thing which I think can also happen relatively quickly, you know, is the idea that, you know, hospital visits for autistic people can be made a little bit easier. And that involves basically epilepsy professionals contacting autistic people and asking them what they want in terms of those hospital visits. With the coronavirus pandemic, many visits, consultations have been digital, which is really important, but some investigations have to take place in the hospital setting. So, for example, MRI, but asking autistic people about their preferences before they actually visit the hospital, I think that's really important, and that can happen really quickly, but it must come with that awareness, you know, among epilepsy professionals that these, you know, visits and investigations can be quite intrusive and quite difficult for autistic people.
Yeah, I mean, if I can just sort of chime in quickly there, for me, hospital overall has never really been an issue. It's kind of always been my safe place. But when I had my surgery, for example, 2 years ago, there was a lot of lack of communication. I really didn't like the idea of staying overnight, so I autistically refused to pack a bag. And it was really very difficult because I wasn't told what was going to happen when, how it was going to happen. I literally got a phone call 5 days before being like, hey, come in on this day and have your surgery. And that was it. And so I think in regards to, it's not just about the environment and the process, but it's the communication that is key. I think one thing that I didn't mention before is for me, mental health wise and access to that has been extremely difficult. I believe that I probably have complex PTSD due to my seizures and my experiences in school, etc. I've been told that I'm probably too complex to go through IAPT, and was referred to see a neuropsychiatrist or psychologist in January 2019, and I still haven't even had an assessment because of COVID. And I think that's something that really needs to change. And I think, with the sort of the lack of understanding of ongoing conditions has been really evident to me over the last year or so. I feel like I've been completely neglected. Nobody's been checking up on my mental health. Nobody's been checking up on how I am. And it's been really difficult to get hold of anyone when a problem has occurred. And I understand, this has been a crazy time, but it's an ongoing condition. It doesn't pause just because there's a pandemic. So I think these are the kind of things that we need to be constantly reminding medical professionals, because if they're not aware of that, then the support just disappears whenever it's not asked for.
Thank you, Susana. I think that's such an important thing to bear in mind. Seizures and epilepsy have not stopped during the pandemic, and it must have left so many people in such a difficult position. So thank you so much, and thank you to Colin and Charlotte for sharing how you think this research will affect people later down the line. And I wonder, Colin, if we could start with you, how have autistic people affected by epilepsy been involved in your research, and how has this added value to the research?
In my presentation, I talked about the PPI group. I think in terms of our 3 aims, 2 of those aims could not really have been reached at all without our PPI group. They gave novel insights, they filled gaps in the research. So basically, when we found very little evidence, we had to go back to the experts and ask them how it was in terms of living, with both conditions, and even like health economics and looking at the economics of having both conditions. We've got a number of new ideas from autistic people with epilepsy, so we hope to take those forward, and there's great opportunities to explore those issues just because our PPI group, talked about their experiences.
Thank you, Colin. And Charlotte, how about you? How have autistic people affected by epilepsy been involved in your work, and how has this added value to the work?
Yes, so we've tried to integrate involvement of autistic people living with epilepsy throughout each stage of the project. As I mentioned, I was able to contribute to the Autistica workshop on epilepsy and autism, and then met an autistic researcher living with epilepsy who is now part of our research team, helped to develop the study protocol, the assessments, and will help to continue feeding back on how we're conducting the study. We've integrated this BPP study, lots of acronyms, which is aiming to identify parent priorities. These, the findings that we gather from this research will be informed directly the way we do our study, the kinds of assessments that we will do, but also how we will analyze the data, what are the most important things that we should be looking at. And finally, we'll be conducting an end of study workshop, bringing together scientists, doctors, and people with lived experience to produce accessible summaries of our findings and think about ways that we can develop guidance for families as well. So taken together, having the experiences of individuals and their families is directly informing our research and making sure that the questions that we're asking might have the biggest impact in the future.
Brilliant. It's so great to hear that the people affected are at the center of both of your research. And Susana, have you had experience of being involved in research yourself?
Yes, so I was actually a member of Colin's PPI, which was pretty cool. And I'm currently working on the Autispaces project at the Alan Turing Institute, which is a fully participatory project. And I'm a real advocate for participatory research. I think it really is essential for many reasons. You know, it gives you more insight, but it also, particularly when we're looking at conditions like this where employment is so difficult, it gives people something to do and a sense of purpose that I really didn't have before I started getting involved in this kind of thing. I'm also a young rep for Young Epilepsy. So yeah, I think I've been involved, I love it, it's where I want to go. And I think it's really important to get more and more people involved.
Thank you so much. And if anyone watching is interested in being involved in research, we'll be sharing the details for our Shape Epilepsy Research Network below, so you can find all the information on that below as well. And I can't believe, but it's time for our final question of the webinar. And we always finish our webinars on this question. And that is, what are your hopes for future research into epilepsy and autism? So Susana, I'd like to start with you, please.
I think for me, it's mainly about that understanding in the wider world, but also, you know, finding therapies that work for both, because talk therapy just does not work with my complicated mind, and you know, I have a lot to deal with. So I need that help. Yeah, for me, as I said, it's all about increasing participation right now. I was shocked 3 years ago when I did my own secondary research for my MA dissertation and realized that there wasn't a single qualitative study about autism out there. You know, things have really changed in the last few years, which excites me, but it needs to keep changing. So that's kind of what I'm hoping to see, that participatory research becomes the norm. And as a result, we can not only find out far more, but stuff that wants to be found out by the autistic and epilepsy community, and, you know, help those people along the way.
Brilliant. Thank you so much, Susana. And Colin, the same question to you. What are your future hopes for research into autism and epilepsy?
Just to echo Susana, that autistic people with epilepsy are involved. If it's basic science or it's qualitative research, they're consulted and they're included. The second area I think is really important is, you know, thinking about epilepsy, and we know more and more about the causes of epilepsy in terms of early onset epilepsies in particular. And, you know, more research there may lead to treatments which can actually not only help improve seizures, but also potentially impact on development and on conditions like, you know, autism, ADHD, learning disability. So really understanding epilepsy better, and through that, you know, maybe impacting on not only on the quality of life, but impacting on those other conditions which can be particularly disabling.
Thank you so much, Colin. And finally, Charlotte.
Yes, I completely agree with Susana and Colin, and developing these kind of more personalized approaches to support for individuals, I think, will be really important. I think also what I've noticed as I've kind of moved into this research field is that there's still this separation between epilepsy and autism in research and clinically in clinical services. And I think it would be really important to encourage crosstalk across these different fields between medical doctors, scientists in different areas like basic science, right through to applied clinical science, and also, of course, individuals, including children and their families. And I think it's only by obtaining all these different perspectives that we can improve awareness and understanding, and design the best research that we can to address the needs of the population, I think.
Thank you so much. And I think that's been such a positive note to leave the webinar on, that the future for research in this area is really on the up. So thank you so much, everyone. I'd like to start off by saying a huge thank you to Colin and Charlotte for speaking about your research today. A huge thank you to you, Susana, for speaking about your personal experiences. And I think they will have resonated with a lot of people watching. So thank you so much for sharing that. I'd like to also thank James and Becca for ensuring that the tech runs smoothly behind the scenes, and to all of you who've been tuning in and watching this webinar, thank you so much for joining us. If you're interested in hearing more from our speakers today, Susana, Colin and Charlotte have all contributed to the research blog. So we'll be linking to their research blogs below so that you can read more if you're interested. We'll also be linking to our Shape Epilepsy Research Network below if you've got an interest in being involved in research in the future. So finally, just again, a huge thank you to everyone for joining us for this Research Roundtable, and we hope to see you again soon. Thank you.